So good evening, everybody. I wanted to let you know that today's workshop is being recorded. And I wanted to introduce myself to you. I'm Nancy Lomibau. I'm the Chief Clinical Officer and Program Director at Cancer Support Community South Bay. We provide free social and emotional support for cancer patients and their loved ones. And today's program is actually being presented by the South Bay Survivorship Consortium. This is a collaboration of healthcare providers and not-for-profit community-based organizations who work together to provide quality information and education for cancer survivors. Today's program is focusing on weight loss 411, navigating safe options for cancer survivors. And I wanted to go over just some Zoom etiquette before we get started here. One is that all of your microphones are going to be muted during the presentation. And so we ask that if you have any questions, you put those into the chat function or into the chat box. And I will be monitoring that and we'll address the questions at the end of the program. And the other piece is that today, instead of a sign-in sheet, we're actually using the participant list that comes up on the screen. So if you have a login name or a username that's creative or a nickname or a phone number, we just ask that you let Rebecca, who is our host tonight, know by emailing her. And I will put her email address in the chat box, but that's so that we can keep track of who's attended and that we can notify you when this workshop recording has become available. And we're going to be doing a quick paper evaluation at the end. Since we no longer use paper in person, you will see a evaluation show up on your screen. It should take just a couple minutes for you to tell us what you thought of the workshop, and then more importantly, or just as importantly, wanting to hear about what topics you'd like to hear about next. I will also be putting the website address for where you can find this recorded program. It will take 1 to 2 weeks to get it up on the website, but I will put that link in the chat box as well. We'll have another workshop coming up in fall of 2025, so be on the lookout for that. And without further ado, I want to introduce our speaker for tonight. Her name is Dr. Lisa Jewell, and she is a board-certified plastic surgeon who's practiced in the South Bay since 2006. She's one of the founding members and owners of South Bay Plastic Surgeons. Also, the spa at South Bay Plastic Surgeons and the Aesthetic Institute Ambulatory Surgery Center. So after earning her bachelor's degree at UC Davis, she received her medical degree at the University of Wisconsin-Madison School of Medicine and Public Health. She completed her general surgery and plastic and reconstructive surgery at the University of Southern California, plus the LA County Plastic and Reconstructive Surgery Residency Training Program. She's earned a reputation for outstanding patient care and results and has been named one of LA Magazine's LA Best Doctors annually since 2017. I'll also add that she is on the advisory board, the professional advisory board at Cancer Support Community South Bay. So please help me welcome Dr. Lisa Jewell.
Hi, everybody. Thank you so much for joining us tonight. I'm very happy to talk to you tonight about weight loss medications and give you the 411 on something that is kind of, out there in the universe that everybody has been hearing about nowadays. I want to dispel some of the myths. I want to give you as much information as I possibly can, and also let you know who can take these medications, who it's safe for, and who might not be a great candidate. So what I'm going to do now is share my screen. Okay, and then we'll go ahead and get started. So, weight loss is something that I think everybody who's in the on the Zoom meeting tonight has struggled with. Otherwise, you wouldn't be spending your Tuesday night with us. I can count myself in that group as well. But weight loss is especially important in cancer survivorship for a few reasons. One is it reduces risk of recurrence. Secondly, it reduces risk of new cancers. It improves survival rates. It reduces risk of other chronic diseases like high blood pressure, diabetes, and kidney disease. Improves overall health, including mental health, and enhances function and energy. You might be wondering why a plastic surgeon is interested in weight loss medication. And let me tell you a little bit about my practice. I know Nancy gave you a little bit of background, but I'm going to give you kind of some additional information that'll make this talk a little bit more cogent. The majority of my practice is breast cancer patients, and I do a lot of breast reconstruction. And I often meet my patients when they are at their most vulnerable. They've just received their diagnosis. They're, very distressed about the unknown. So, what their treatment will be like, how their body will change. And I follow my patients very closely, sometimes for decades. I've been in practice almost 20 years, so I guess it could almost be 2 decades for some of my patients. And one of the things that I've noticed in my practice is that oftentimes when they're finished with their treatment, either their primary care doctor or their oncologist might recommend weight loss to enhance all of the things that I just described as important in cancer survivorship. But they get really frustrated, and rightly so, because it's kind of like, okay, you should lose 10, 15, 20 pounds, that'll really improve your risks. But sometimes there's really a lack of guidance or help. And we all know that weight loss is incredibly difficult and incredibly frustrating for many of us. And so, for a cancer survivor, it could even be like adding insult to injury. Like, okay, well, I just finished fighting for my life, and now you're telling me that I have to go on a diet. Like, kind of give me a break. But we know that it is important for health benefits and survivorship. And so it is helpful to have some tools in your toolbox to make this not such a difficult task, and, to help jumpstart that road to survivorship and to improved health and happiness after cancer. So let me kind of go and start by saying, why is weight loss so hard? Well, weight loss is hard because when we lose weight, our brain literally sees this as a threat to our survival. When you eat less, your brain increases hormones and hunger signals that increases your hunger and reduces your feeling of fullness or satiety. When you cut calories, your metabolic rate slows down to conserve energy. You burn fewer calories at rest, so it makes it easier to gain weight and harder to lose weight. Restrictive diets that cut out certain foods, like the no carb diet or no dairy diet, all those things do is create this reflexive psychological response of deprivation. And that leads to more cravings, binges, feelings of guilt, and then just kind of this vicious cycle that continues with these poor food choices. Your body also tries to maintain a set point. And when you go outside of that set point or drop below a certain weight range, your body is going to push back. It's going to try to increase your hunger, reduce your energy expenditure, and alter hormones so that you store more fat. And then finally, and I think that this is where weight loss medications really hit home, is that our willpower is like a battery. And we all know that with stress, with low energy, with other emotional changes, that battery can get really, really depleted. And it makes it very hard for us to make good decisions when our battery is low. So in addition to the physiologic problems that all of us have with trying to lose weight, cancer survivors have some extra challenges. For example, chemotherapy or radiation therapy can often change how foods taste. You know, food may not be as flavorful as it used to be, or things that you used to enjoy, you may not enjoy anymore. And so oftentimes people seek out more flavorful and often really calorie rich food to replace those things that they no longer enjoy. Um, some treatments require blocking hormones or changing hormones, and those changes can lead to a slower metabolism. Chronic pain that some survivors face can make exercise really, really difficult. And we know that exercise is a very important component to weight loss. And so that can be an, even more insurmountable task to try to get out there and exercise when your body just hurts. There's a lot of psychological changes that occur during treatment and afterwards. Body image changes. There might be a lot of stress, some depression, some other emotional changes that make people lose motivation or not want to kind of participate in exercise or participate in making healthy choices. And then there are practical barriers. So there may be financial strains, childcare strains, having to go back and forth to doctor's appointments that really make it difficult to make time for survivors to make healthy choices, prepare meals ahead of time, or even just find time for exercise. And oftentimes there aren't resources for patients like nutrition classes or fitness classes that really focus on the special challenges that some survivors face. So the problem with modern dieting, everybody knows a balanced diet and exercise is great. But in the past, we've kind of viewed the willpower component or the healthy choice component as some sort of moral failure or a failure of willpower. And, what we've learned as weight loss medications have come more to the forefront of our society is that's really not true. To lose weight, we have to do our best to follow a balanced and healthy diet and get plenty of exercise. But it's our physiology and the special challenges that some people, some groups of people face, like cancer survivors, that make these willpower components really, really, really difficult. And that's why dieting with this kind of traditional thought process that it's really, willpower that's helping you make these healthy choices. That's why they fail, because it's really not willpower. It's our physiology that makes it difficult for us to make these healthy choices. So what these weight loss medications do is they level the playing field. They help change our physiology, starting in the brain, so that the willpower component is really taken out of it. It helps our brain have space to think about what we're eating, think about our choices, think about exercise, rather than feeling this physiologic drive to just eat food when it's available and eat high calorie food when we're hungry or stressed. So I'm going to give you just a quick little history on glucagon-like peptides. And glucagon-like peptides are the basis of the medications that you're hearing about in the news: Ozempic, Wegovy, Mounjaro, Zepbound. These are all glucagon-like peptide or GLP medications. And these medications aren't new. That's one myth that I really want to kind of dispel during this talk is that these medications have been around for a very long time. But it all started back in the 1960s when it was discovered that when people eat food or eat sugar, our pancreas releases more insulin than it would if we got the same amount of sugar put into an IV. And so, if you think about it for a minute, that means that there's something special about food going through our digestive system that increases this insulin release. And this phenomenon is called the incretin effect. It's basically the phenomenon where eating food is going to stimulate more insulin release from the pancreas than just getting sugar in the bloodstream. And so that led people to think, well, in the past, we always kind of thought about the gut as just being a digestive organ, but the gut must actually release chemicals that communicates with the pancreas to tell it to release insulin. And so in around the 1970s and 80s, scientists discovered two peptides that serve this function. GLP-1 or glucagon-like peptide 1 and glucose-dependent insulinotropic polypeptide or GIP. And I will not make any of you guys actually say that. So it was found that these chemicals actually created a stimulus for the pancreas to release more insulin, and it was a huge boon for treatment of diabetes. So a lot of these medications started out as treatment for diabetes. The problem with these peptides is that if we just got a bunch of this peptide and injected it into a patient, it wouldn't last very long. They get broken down very, very quickly. So it wasn't until the 1990s when somebody, I don't know who these scientists are that go looking for medication in the saliva of handsome fellas like the Gila monster. But it was molecules like GLP were found in Gila monster saliva. And instead of being broken down right away, they had a much longer effect. And so it was actually in the 1990s where these medications started to become manufactured and available for use in patients. And then finally, in 2005, so 20 years ago, the first glucagon-like peptide medication called exenatide or Byetta was FDA approved for the treatment of type 2 diabetes. And this, was followed pretty quickly by other medications. In 2014, liraglutide was approved, also known as Saxenda. In 2021, semaglutide, which many of you will know as Wegovy. And then in 2023, tirzepatide, which is Zepbound. And these are all medications that were once formulated to treat diabetes that were then repackaged, redosed for the treatment of weight loss, because the big side effect of these medications when they were given to people with type 2 diabetes was weight loss. So, like every good drug manufacturer, if they see a beneficial side effect, they're going to try to market it for that purpose. So how do these medications work? And this is the really, kind of fascinating part of this whole story, is that the medications don't just work on the pancreas. They work in many different areas of the body, and some of them we probably don't even really know yet. But GLP medications work directly on the brain, and they work on the brain to increase feelings of satiety or fullness, to reduce feelings of hunger. And so basically, this means that when you're on this medication, you feel satisfied for longer with less food. And so if you feel satisfied for longer with less food, you're going to lose weight because you're not constantly feeling hungry and you're not constantly seeking out food. This medication also reduces cravings. So, for me, my big craving was those Trader Joe's dark chocolate peanut butter cups at 9 p.m. And, I couldn't just eat one, I would have to eat a handful of them. So, medications, GLP medications really work in the brain to reduce that impulse to sit down at 9 o'clock and eat something that you really don't need or shouldn't eat. The other thing these medications do in the brain is they decrease our interest in high calorie, high fat, or high sugar foods. So instead of looking for those Trader Joe's dark chocolate peanut butter cups, an apple might actually sound better. And I know that sounds really weird. How can a medication flip a switch in your brain to make you want to eat an apple instead of dark chocolate? But somehow these medications really do kind of change our palate. They also work in the gut, and that kind of makes sense because that's where they were discovered. Their action was discovered as food traveled through the gut. And how they work in the gut is to slow down gastric emptying or gut motility, which basically means that once food is in the stomach, it sits there longer than it normally would without the medications. And as it sits there longer, we feel full longer. So instead of feeling hungry again an hour or two after dinner, 3 or 4 hours later, you still feel satisfied, you still feel full. Um, this will also lead to reduced intake because if you feel full, you're really not going to want to sit down an hour or two after a big meal and eat again. So the slowing down of the gut and having food in the stomach longer just decreases those hunger signals. And then we know that somehow the GLP medications send signals to the pancreas to release more insulin, which is really helpful in the treatment of diabetes. So in people, especially with type 2 diabetes who have insulin insensitivity or are not releasing enough insulin, these medications help enhance the release of insulin from the pancreas. It also improves insulin sensitivity and it reduces the spikes in blood sugar that often create a sensation of hunger after meals. So increased release, increased sensitivity, and then more of an even blood glucose level after meals really helps reduce hunger. So currently there are only 3 medications that are FDA approved for weight loss. And those are liraglutide or Saxenda, semaglutide, which is Wegovy, and tirzepatide, and the brand name of that is Zepbound. Zepbound or tirzepatide has also the GIP peptide, which I'm not going to try to say the full name again, but if you remember the Gila Monster slide, it is another glucagon-like peptide, and it works in a very similar way. So tirzepatide or Zepbound is a compound medication. It has 2 peptides that work in a similar fashion to help with weight loss. All of these medications work in a similar way. The big difference between liraglutide and semaglutide or tirzepatide is that liraglutide is a daily injection. So this is a medication that you have to inject on a daily basis. Semaglutide and tirzepatide, on the other hand, are weekly injections. So just a once a week medication. Semaglutide and tirzepatide also have a higher percent of initial body weight loss. So we'll just take a 100-pound person to make the math easy. If that 100-pound person happened to be overweight and wanted to lose weight, they're going to lose 15 to 17 pounds of weight. If they are on semaglutide or tirzepatide, versus 5 or 10 pounds if they were on liraglutide. All of these medications also have very similar side effects. Those side effects are nausea, diarrhea, constipation, vomiting, abdominal pain, headache, and fatigue. And then with tirzepatide, there's an additional indigestion that's commonly seen in patients who are on these medications. Most of these side effects, if they occur, are mild and transient. So they don't last very long. Typically, once someone has been on the medication for some time, these side effects improve. And then you can see at the bottom of this slide, all of these medications are very expensive. So it is really, really costly to be on these medications if you are paying out of pocket. The interesting thing about these medications is that we are now finding, as people, more and more people are taking them, that there may be some other benefits in addition just to the weight loss. For example, people who have been on GLP medications tend to show some cardiovascular benefits. So there have been reductions in major cardiovascular events like heart attack and stroke. For people who have non-alcoholic fatty liver disease, there seems to be a significant improvement in loss of liver fat and also loss of visceral fat, which is the fat that collects around our organs when we gain weight. In people who have diabetic kidney disease, these medications are showing some improvement in their kidney function. In patients who have polycystic ovary syndrome, it seems to improve their insulin insensitivity and even improve some of their fertility. And some of these medications are actually used as an adjunct in some infertility treatments. And then finally, one of the most interesting side effects of these GLP medications is that they tend to reduce addictive behaviors. And so for people who have, for example, an addiction to alcohol or an addiction to impulsive type activity like gambling, there tends to be a decrease in those activities in people who are on these medications. And I don't think yet that we have a really good explanation for that, other than these medications seem to affect some of the reward centers of our brain. And another really interesting finding is that being on these medications may improve brain health. And it's unclear if this is a direct effect of the medication or if it's a side effect of the weight loss. But there may be some promise in people who have dementia or Alzheimer's, seeing some improvements with these medications. So who can take these medications? One of the purposes of this talk tonight was to talk about safe options for the cancer survivor community. And these medications, even though it just seems recently that everybody is talking about them and everybody is using them, have been around for a very long time for the treatment of type 2 diabetes. And we know that they are very safe for use in the majority of patients. But there are FDA guidelines for who should use these medications. For liraglutide and semaglutide for weight loss, the FDA guidelines are for use in adults and children older than 12 years old with obesity, and that is described as a body mass index greater than 30. Or adults and children older than 12 who have a body mass index of 27 or greater and have another weight-related disease like high blood pressure, diabetes, or non-alcoholic fatty liver disease. Tirzepatide is only FDA approved for weight loss in adults, and it's for adults with obesity or a BMI of greater than 30, or overweight adults who have one more weight-related disease. So there are very few contraindications or absolute contraindications for these medications. So anyone that's had a personal or family history of medullary thyroid cancer should not take these medications. Anyone who has multiple endocrine neoplasia or MEN type 2 should not take these medications. And then, like all medications, if you have a hypersensitivity to the drug, which you unfortunately wouldn't find out unless you took it, or one of its components, or if you're pregnant or breastfeeding, you should not take the medication. Typically, in people who have gone through cancer treatment, these medications aren't started until your treatment is complete. There are some relative contraindications, and these mean that people who have these conditions probably shouldn't take the medication, but it's really not clear. And in some circumstances, it may be okay to take them. If someone has a history of pancreatitis, we know that some of the GLP medications can cause pancreatitis in some patients. So if you have a history of pancreatitis, this is probably not a great first step or first choice for you. If you have type 1 diabetes, these medications typically are not encouraged because they don't give the benefits to people with type 1 diabetes that they would to people with type 2 diabetes. And they can worsen some hypoglycemia or low blood sugar. Because these medications can cause constipation and sometimes severe heartburn in patients, people who have severe gastrointestinal disease like gastroparesis. So some patients with diabetes actually have a problem with their stomach emptying. Their stomach is paralyzed, so food does not pass through the stomach very easily. You definitely want to think twice before you start this medication. And some patients who have inflammatory bowel disease are discouraged from using these medications. And even though they have found some benefit in patients who have diabetic kidney disease, you definitely want to make sure or monitor kidney function if you already have kidney disease before you start taking the medication. There is some evidence that patients who have diabetic eye disease may have worsening of their symptoms after starting this medication. And then finally, for surgeons like me, I definitely want to know if my patients are taking these medications because it can make anesthesia a little bit more risky unless they stop taking the medication about a week or two before surgery. So I mentioned before that these medications are really, really expensive. So the best case scenario is that if you think you're a candidate, meaning you are an adult and you are either obese or overweight and have at least one other weight-related condition, we want your insurance to cover this. So if you meet the FDA criteria, you have a very good chance that your insurance will cover it. Particularly if you have Cigna, Aetna, some Blue Cross and Blue Shield insurers, and some United Healthcare. But you want to make sure that you check your benefits before you try to get the medication because not all plans will cover the medication and it can vary by state. If you don't meet the FDA criteria, your insurance will not cover the medication. And also, you should know that Medicare, Medicaid, and the Affordable Care Act marketplace plans typically do not cover the medication. So if you feel that you qualify and you're interested in starting the medication, the first step that you should take is going to your doctor. So go to your primary care doctor. If you have type 2 diabetes or another endocrine problem and you have an endocrinologist, even your oncologist, talk to them. Tell them that you are interested in trying these medications. And there are some doctors out there that either, aren't experienced or just don't feel confident prescribing these medications to patients. That's okay. There are some online services that are reputable that can prescribe the medications for you and can follow you through your weight loss. And I just listed some of them here on this slide. And then actually a patient of mine let me know that Weight Watchers also has a GLP medication program. And the really great thing about Weight Watchers is that not only can they connect you with a doctor that can help you get the medication and prescribe for you, but they also have nutrition and counseling services that they can help you with. So they can help you with that balanced diet that you want to use while you are using these medications. So I think Weight Watchers is an excellent option for patients who are interested in trying this, and they will help you go through your insurance policy. Unfortunately, if you can't get the medication through your insurance, then you would not be able to get the medication through Weight Watchers. So if you don't meet the FDA criteria, meaning you're not technically obese or your body mass index is 26 or it's 27 or 28 and you don't have another weight related condition, can you still get the medications? The answer is yes, you can. And there are a couple ways that you can do that. One would be to see your doctor or healthcare provider, get a prescription, and pay out of pocket. Considering how expensive these medications are, that would not be my first choice. But if you are able to, that is an option. Manufacturers of these medications almost always have coupons. So if you are prescribed Wegovy, if you are prescribed Zepbound, you can go to the website and see, or just do a Google search for manufacturer coupons for these medications. Oftentimes you can get really good discounts for the medications just with the manufacturer coupon. Then you can go to pharmacy comparison sites. So something like GoodRx will help you locate the pharmacy that has the lowest prices for these medications. And there are even some manufacturers that are doing a direct to consumer launch. And I think Wegovy might be one of those medications. So if you are able to get a prescription, you might be able to get this medication directly from the manufacturer. And then, of course, there are some cash pay options, weight loss clinics who would be able to provide you with the medications or a prescription. And maybe not for the name brand medication, but for a compounded option. Which brings me to my next topic. So off-label use basically means that you're using one of the medications that is exactly the same medication. So we'll use semaglutide as an example, but you're using Ozempic. Ozempic is not a weight loss medication. Ozempic is a type 2 diabetes medication. So if you don't have type 2 diabetes and you are using Ozempic for weight loss, that is an off-label use. And that is totally legal and totally common. We use so many medications off-label. It is perfectly fine. You want to make sure that you are being followed by, a trusted healthcare provider if you're using medications off-label. And you want to make sure that they're following your weight loss progress. The most common off-label weight loss medications are what you see listed here. So the liraglutide or Victoza, that is the type 2 diabetes formulation of liraglutide. We know that liraglutide also causes weight loss. Semaglutide, Ozempic is the formulation for type 2 diabetes, still causes weight loss. And there's also an oral option called Rybelsus of semaglutide. So instead of having a weekly injection of the medication, you would take an oral pill every day. The tirzepatide option is Mounjaro. And so again, type 2 diabetes medication still causes weight loss. And then finally, there are some compounding pharmacies that can make these on a prescription basis for you with a prescription from your provider. Compounded medications are custom-made versions. So they are not Ozempic, not Mounjaro, not Victoza, but custom-made versions of these medications. And it's typically allowed when these name brand medications are in short supply or become very, very expensive. And that is why compounding was available for a lot of these weight loss medications recently, because so many people, were having such success with weight loss that it became very hard to find the medications. And so the FDA allowed compounding pharmacies to formulate these medications on a patient-by-patient basis. If you are using a compounded medication, just make sure that you're getting it from a reputable provider and a licensed pharmacy, because compounded medications are not FDA approved, and the FDA does not verify the safety, the quality, or the efficacy of the medication. So you just really have to proceed with caution if you are using a compound. And make sure that you're using a licensed pharmacy. So there are only pharmacies that are licensed as compounding pharmacies are available to provide these medications. So once you are able to use the medication, does that mean that you just sit on the sofa and, instead of eating the one dark chocolate peanut butter cup, instead of eating 5, dark chocolate peanut butter cups, you're just eating the one dark chocolate peanut butter cup, and that's how you lose weight? That's not the goal. That's not the kind of vision that, your doctors have for your weight loss and health success in survivorship. So a healthy weight loss looks like 2 pounds per week. So if you're on a medication and you're losing 5-10 pounds per week, that is way too fast. That's not healthy for you. Your skin is going to lose elasticity. You might lose some hair. You might have really brittle or dry nails and dry skin. A safe weight loss is about 2 pounds per week. And so that should really be a realistic goal for you. The medication helps reduce the cravings. It helps reduce seeking those really high calorie, high fat, high sugar foods. So use the serenity that the medications give you to focus on a more balanced diet. So a diet that really increases your fruit and vegetable intake, increases your protein intake, and increases your fiber intake. Protein is really, really, really important when you're taking these weight loss medications, because when you're not feeling hungry and you're feeling full, eating protein can really be challenging. And so it's important to try to calculate what your protein intake needs are so that you can try to meet those goals during your weight loss. If you're an adult that doesn't exercise a lot, I would encourage you to start. But if you haven't gotten there yet, typically you need around 0.8 grams per kilogram of body weight. So if you're 100 kilograms, you'd need, 80 grams of protein. For somebody who is age 40 to 50, we start losing muscle. So we should be increasing our protein intake anyway. So for those patients, you need about 1 gram per kilogram. And then if you're somebody who exercises regularly already, you don't want to lose the muscle that can go along with the weight loss. So you really want to increase your protein intake and try to get about 1.5 grams per kilogram of your body weight. These medications do cause constipation, so it's really helpful to increase your fiber intake. The best way to do that is with food. But if you don't feel like you can get enough of it with food, then a fiber supplement is something that you may want to add. Hydration is also really important. These medications also kind of dampen your thirst. And so you may not feel thirsty. So you're going to have to be one of those people that carries around a big Stanley mug or, those liter water bottles and make sure that you're getting enough water during the day. And then finally, exercise. So exercise is a very important component of any healthy lifestyle, whether or not your goal is to lose weight. And for adults, 150 minutes of moderate intensity exercise or 75 minutes of high intensity exercise weekly is really, really important. And 2 days a week, you want to try to get some strength training. So, especially as we age, for those of us that are in menopause, our bones are getting weak, our muscles are getting smaller. We really need to increase our strength training so that when we fall, we don't break a hip and we maintain our muscle mass. So these weight loss medications have really, I think, changed the viewpoint of the traditional diet. So, in the past, we've always talked about, eating healthfully and getting exercise, and then just through sheer willpower, making healthy choices, even though our brains, our physiology, our gut, our hormones are telling us to eat that donut. We know that's going to fail. We wouldn't be sitting here tonight if it was easy to make those choices. These weight loss medications really kind of level the playing field a little bit. They take away that huge component of willpower that most of us don't succeed at when they're trying to lose weight or trying to change to a more healthy lifestyle and diet. So that you can then shift your focus to more healthy foods. And as you start feeling better and losing weight, increasing your activity and increasing that healthy lifestyle. Thank you very much, everybody. I really appreciate your time and joining us tonight. Does anyone have any questions for me?
There are some questions here in the chat box, so
Okay.
I'll go through those first. The first one is asking, is berberine safe for post-uterine cancer for weight loss?
Berberine. That is something I do not know anything about, so I would not, I wouldn't try to give advice on that.
Okay. Understood. This next question is asking, what is a good protein shake for weight loss?
Oh, so I really like Premier Protein. It is you don't have to refrigerate it. It is, I think, available at Target. I order it from Amazon. There's about 30 grams of protein per shake, and I think it's 120 calories. So it's a really easy way to get protein when you either don't have the appetite for eating 30 grams of lean meat or 30 grams of legumes. And they're tasty. I mean, I like the chocolate and they have like a cappuccino or something with a little bit of caffeine. Those are both really good. So I'd recommend Premier Protein. I know that my partners, they're guys, they like to lift weights, they like to build muscle, and they use there's a Lifeway protein shake that I think you can get at Costco that they really like too.
Gotcha. Okay. We have someone asking a question that I think you answered. Do I ask my PCP or my oncologist for a prescription? But I'll allow you to answer again.
Yeah, I think you can ask both. Whoever you feel the most comfortable talking to about concerns about weight loss or weight loss goals. usually it's your oncologist that's really pushing you to lose weight in survivorship. And so, that may be a good resource to ask. I found that, there are some primary care physicians that maybe don't feel comfortable or are not familiar yet with these medications, and also may not have the time in their practice to dedicate to following patients who are using these medications. So I guess the short answer would be whoever you feel the most comfortable with and whoever you can get in to see sooner.
Okay, great. I'm going to just jump down because someone mentioned that they love Shakely or Shaklee protein shakes. It's organic
Great,
and 20 grams of protein. So
good.
that
I'll
was
try it.
shared in the chat box there. Someone's asking, can you share the slides via email? So are you open to sharing your slide deck, Dr.
Sure.
Jewell?
Yeah.
Okay, so for everybody then that has their email registered with us, we'll send that out, and it'll also be posted then alongside with the video on the website in about 2 weeks. Let's see, there's about 3 or 4 more here. My endocrinologist said she'd put me on it in 2023 after my ER positive NN, I think maybe node negative breast cancer. Then some research came out in 2024 stating it was bad for cancer survivors. So I got fatter. Is it now okay for cancer survivors?
Um, the literature that I have seen does not mention a previous history of non-thyroid or somebody who does not have multiple endocrine neoplasia type 2 as a contraindication for use of these medications. So as long as your breast cancer is not related to multiple endocrine neoplasia type 2, I think that you can safely take this medication.
Okay. This person's saying, I'm right at the BMI of 30. If I drop below 30 during the treatment, does that disqualify me immediately from receiving the
Mm.
medication via my insurance?
Yeah, that is a really, really good question that I am not sure I know the correct answer to. I will say it would not surprise me that if you lost 5 pounds and dropped below 30, that they would say you no longer qualify. I think it makes much more sense to use the medication to get you to within a healthy weight, which would be a BMI of 25 or less. So I'm sorry I don't have that perfect answer for you. I think get on it any way you can and just hang on as long as you can to get to that healthy weight.
Okay. I'm going to take this chance to remind everybody to please stay on to take the evaluation, but I do have a couple of questions that were directly messaged to me that I wanted to ask as well. So somebody's asking, does having gallstones prevent you from taking the medication?
Yeah, good question. And no, it's not a contraindication. However, weight loss can make cholecystitis or your risk of cholecystitis go up. So you already have cholelithiasis, which means that you have gallstones. If you have a very rapid weight loss, sometimes you can get inflammation of your gallbladder, making that condition worse. I have not seen any literature that says that you are at higher risk of cholecystitis with this medication as long as you are not rapidly losing weight. And what I mean by that is 5 to 10 pounds a week. Even if you lost 5 to 10 pounds a week without the medication, you would be at risk because of your gallstones. Pancreatitis is a concern with some of these medications. Again, it's unclear if this is a result of the medication itself or the rapid weight loss. So I would suggest talking to your primary doctor about it. I think you could try the medication and just be very, very aware of any changes in your GI habits, any right upper quadrant pain or discomfort. Just make sure that you're being very aware of any changes that might indicate you're having symptoms related to your gallstones.
And this person asked sort of as a follow-up, is it possible to have a reduced dose of the medication to circumvent side effects such as the one mentioned with gallstones.
Yeah, yes, but it may not lead to weight loss. So, one of the things in treatment of patients with these medications is that you want to titrate the dose upward. So we typically will start at the very lowest dose of treatment and then increase incrementally until you start losing weight. And then the weight loss goal is about 2 pounds per week. So doses that are subtherapeutic probably aren't worth taking if that's, I guess that answers your question.
Okay. And then if somebody is not eligible for a GLP-1 medication, what would you suggest as the next option towards weight loss?
Mhm. That's a really, really good question. So if you're not eligible for a GLP-1, then I think there are two in particular options for you, and that would be using a kind of support-based program like Weight Watchers. Noom is also a web-based version of like a lifestyle and therapy kind of support weight loss option for you. There are some other medications that are used for weight loss. I'm just really not uh, informed enough to be able to recommend those medications. But I think the very first step in any weight loss plan would be to talk to your doctor. Talk to your doctor, see if there are some nutrition resources available through your insurance. I think a lot of us underutilize resources that are available to us through insurance. If your insurance doesn't have options available for you, then I would reach out to Weight Watchers or an online resource like Noom.
Okay. So one more question, and then somebody wanted to ask a verbal question, meaning
Okay.
they're going to unmute. So here's somebody's asking, do you think that it's safe for those on immunotherapy for life to take the medication?
Yeah, I don't know the answer to that. I think that would be a really good question for your oncologist. I can do a little research into that. That I don't know.
Okay. I think someone jumped in with a question about metformin as an
Mm.
option instead. I don't know if
Yeah,
you thought
so
on that.
metformin is a very good medication for, I would say, a little bit of weight loss. So, people who do not have type 2 diabetes who take metformin can expect to lose about 5 to 10 pounds of weight. That may not be sustained over time, but that is a very common side effect in people who start the medication. In It's often used as an adjunct with some of the GLP medications as well. So, in people who tend to be a little bit resistant to the GLP medications, oftentimes metformin is added to the formula, and that kind of bumps them up to that 2 pounds per week of weight loss.
Okay. And then I see the individual, do you want to unmute yourself? You had a verbal question to ask.
Yeah, thank you so much. This was a really informative presentation. Was just wondering if you recommended it for maintenance. So, for instance, I lost a lot of weight after treatment. And I've noticed, in the past 6 months, since I've fixed some other problems that I'm 100,000% thrilled to have fixed, particularly affecting mood and other things, that I'm eating
Mm-hmm.
again. And so my weight's crept up by 10 or 12 pounds, and so
Mm-hmm.
I'm kind of like, well, is this something that I might consider for a maintenance, or, because I don't want to get to where I was, because I was at a very unhealthy weight.
Mm-hmm.
Um, have
Can
any
you just
thoughts?
clarify, had you been on the GLP medications before, or when you said treatment, is this cancer treatment that
It
you
was
lost
cancer
weight with?
treatment,
I
yeah,
see. Okay.
and I had a really strong reaction with menopause and anxiety that caused me.
Mm-hmm.
I mean, I just didn't eat for like a year and a
Yeah.
half,
Yeah.
literally.
Yeah.
So, and now that I'm happy and okay, what do you know? I eat again.
Yeah, that is a really interesting question. I do know that in patients who have had success with these medications, that oftentimes we do keep them on a maintenance dose over time. I'm very unfamiliar with using it to sustain a desired weight in somebody who didn't use it to lose weight. I suppose that it would be I suppose we could titrate, or your doctor could
Right.
titrate the medication so that you're not actually losing weight, but you're not gaining it.
Right.
So I imagine that it's definitely doable.
Okay.
And
Thank you.
you almost certainly would not be able to get it covered through insurance.
Yeah, exactly. Yeah, that because I was looking at all your criteria and I'm like, yeah, probably
Mhm.
cost prohibitive.
Right,
Yeah. Yeah.
right.
Thank you.
Mhm.
Well, Dr. Jewell, before we wrap up, I just wanted to remind everybody that in the chat box, there is the survey link. So please, if you could take a couple minutes to complete the survey, we'd really appreciate it. And then the second piece is there is a National Cancer Survivors Day flyer that is in the chat box, and Torrance Memorial and Cancer Support Community South Bay will be co-hosting a luau over at the Hunt Cancer Center in Torrance on June 1st, and it is from 1 to 3 p.m. and it's absolutely free, and it's a day to celebrate all of you who are survivors. So hopefully you can check that out. But Dr. Jewell, we really just want to thank you for your knowledge and taking the time to go through all of the questions. And I see a lot of thank yous for your time and kindness, and really complimenting you on such a great workshop. So thank you, Dr. Jewell, for being
Yeah, thank you guys. I really appreciate that. Thanks for
all
the
right.